Thank you. So I will present the data that me and my co-workers have done, looking at the preserving effect that dapaglifozin have on renal function. And we've looked at across clinical trials to sort of build confidence in the analysis. So we used a linear mixed effect model that's illustrated here. It has an immediate effect on eGFR already after the first dose, and then a linear disease progression effect, both for dapagliflozin and placebo. And to account for differences in study population, we've assessed baseline covariates on the effect on placebo, such as eGFR, duration of type 2 diabetes, HbA1c, age, gender, race, and the trial effect in itself. And then we've added dapaglifozin as a covariate in the model. The dataset contains 8 clinical trials with dapaglifozin of different doses, all including placebo. It's 4,894 subjects with over 58,000 eGFR measurements. And the treatment period is up to 2 years. 39% had established cardiovascular disease and 19% had hypertension. Most patients had mild renal impairment and 17% had moderate renal impairment. And most data is coming from placebo and 10 mg dapagliflozin. Here you see the result, the simulated eGFR over time for placebo, 5 and 10 mg dapagliflozin in the reference patient. And the reference patient is matching the demography of the mean patient in the data set we used. So it's a 60-year-old white male with an eGFR of 78 milliliter per minute. And you can see the small initial drop for dapagliflozin. It's about 2.3 milliliter per minute for 10 milligram dapa. And the corresponding effect on placebo is a drop of 0.5 milliliter per minute. And then you can see a gradual increase in the eGFR when patients are treated with dapagliflozin, and a progressively decrease in the eGFR of placebo of about 1 milliliter per minute per year over the 2-year treatment period. Whereas then you see a sort of a net preserved effect for the dapagliflozin, which is dose dependent. On 5 milligram, the net preserving effect is 1.6 milliliter per minute per year, and for 10 milligram it's 2 milliliter per minute per year. And then you here also see the simulated eGFR over time when a patient receives 10 milligram of dapagliflozin on various baseline eGFR. And here you can see that if you have a normal renal function, you have a small drop of about 3 milliliter per minute. But if you have a eGFR of 45 to 60 milliliter per minute, there is essentially no drop when starting the treatment. So to conclude, by integrating data from several clinical trials, we've quantified the preserving effect of dapagliflozin on renal function. And this builds confidence in the ongoing renal outcome study, DAPA-CKD. So thanks for listening.